steps to wellness.
Welcome to Healing Step to Wellness. I'm Dr. J,
I'm May,
your trusted guide to whole person health, one step.
and one bite at a time.
Today, we have the pleasure of talking to our dear friend, Dr. Wayne Dysinger. Dr. Dysinger has a very long background. I think it'll take about 30 minutes. So I'm going to cut it short a little bit. Dr. Dysinger is the founding member and the past president of the American College of Lifestyle Medicine. Is also the founding president of the American Board of Lifestyle Medicine, as I understand. And he was the former chair of the preventive medicine at Loma Linda University. And he is currently the chief medical officer of the Blue Zone Health. So before we start, I really want Dr. Dysinger to give us a little bit of the introduction on himself. Dr. Dysinger.
Thank you, Jeng, and it's great to be with you and May. We are good friends for many years now. I've visited your clinic at least 2 or 3 times. I don't remember exactly how many there in Rochester, and really have appreciated how you've been a leader of lifestyle medicine in your community, and throughout the podiatry world, actually. You know, I'm a primary care physician. That's what I was trained to do, and that was sort of my core training. I also did training in preventive medicine, and then for the last 25 years, I've been on this lifestyle medicine ride, and it's been quite a ride. It's been a lot of fun, and you know, we're in a good place and excited to see what the future holds.
Sure. And so let's start from lifestyle medicine. You know, you have been involved in lifestyle medicine from the early days, 25 years ago at least. Did you ever imagine the movement will grow that the size, the scale today?
No. In fact, in some of those early days, this would be in the mid 2000s, so like 2005, 6, 7, through that range. You know, I was sort of placing bets, hedging my bets, I guess would be a way to say it. And so I was sort of trying to be cautious how much I was going to commit to what was going on with the American College of Lifestyle Medicine back then, because I wasn't sure that it was going to even continue to exist. But here, you know, starting, you know, 8 to 10 years after the American College of Lifestyle Medicine started, it really started taking off, and that's due to a variety of reasons. Some of it is people, some of it is just being at the right place at the right time. But yeah, it's certainly done way more than I would have guessed, and I don't think it's peaked yet. I think there's more to come.
Good.
I agree. Yeah. I want to also comment about Dr. Dysinger is so special. He's a good friend, dear friend of our late mentor, Dr. Hans Steele. Also, as a part of a teaching of a complete health improvement program. So far, I still think that is the best by far for over 4 decades of Dr. Steele's commitment in the improving, I mean, not only human being, but it's kind of a global health and wellness in general. And that was the kind of first step that we got involved with the lifestyle medicine, eye-opening, allow us to use that proper tool along with the teaching. You know, the principle that Dr. Dysinger has been involved past that 11 years of a time frame as we on this lifestyle medicine journey. And quite frankly, you know, just like, you know, Dr. Dysinger's comment in the past, when we started it, we were so excited, but we didn't know, you know, how long and how far it will take us on this journey. But we have seen the I mean, it has been evolved so far and bigger than what we have imagined way back to 11 years ago. So thank you very much for your dedication. You are very special to us, personal growth, but also very special to our clinic. As a only clinic practice lifestyle medicine, and also very instrumental to our past providers as well.
Well, thank you, May, and yes, thank you for bringing up Dr. Hans Deal because he was my mentor in the lifestyle medicine world as well. I believe he's who first introduced us. I think Dr. Deal introduced me to you back many years ago, and yes, I was the medical director of the Complete Health Improvement Program, Dr. Deal's baby, you could say, his
Yes.
intensive therapeutic lifestyle change program, community-based ITLC program. I was a medical director of that for many years, and then I pulled away from that for several years. During that time, the Complete Health Improvement Program was revised and it was renamed. It's now called PIVIO. And just recently, and you may not even know this yet, but just recently, I'm now the medical director of PIVIO again.
Oh,
So I'm working with that organization again, and the reason that came about is because the U.S. government is pushing into lifestyle medicine right now
yes.
with the Make America Healthy initiatives, and there's two specific ones. One is Make America Healthy Again Elevate, so it's called MAHA Elevate, and the other one is Make America Healthy Again Access, so called MAHA Access. And PIVIO, MAHA Elevate is basically a grant kind of process. And so submissions were put in. The results won't come out for another couple months, I think, as far as who was accepted for these grant processes. But then MAHA Access is basically a technology play, and PIVIO has been approved as a MAHA Access partner with the Centers for Medicaid and Medicare Services. So now, if you have original Medicare, starting July 6th, so starting last week, you can have PIVIO paid for by Medicare. You have to contact PIVIO, and we'll work with you to have that happen. So a little bit of a long response there, but it's important stuff, and it's stuff that we haven't had a chance to talk about yet.
Wow, that's really good to know because we still continue to consider using the CHIP program to help people reach their optimal health, which has been very successful. So this is such a great news.
Yeah.
Yeah, it's exciting. It's exciting, and to me, it's a representation of how far the lifestyle medicine movement comes.
Yes.
Where now the federal government is creating programs that are based on the lifestyle medicine 6 pillars. They're specifically called out in those programs, and putting good money and good resources towards promoting ways to get lifestyle medicine in front of Medicare patients across the country.
Wow. Okay. We should learn more of about that from.
Yeah, that'll be another
Yeah.
conversation
Yeah, another
offline from
conversation.
this podcast, right?
But this will be a great way to promote it, let people know. Hey, tune
Exactly.
in.
Yeah, exactly.
So when we look back, all of these evolutions, how lifestyle medicine coming from a concept and to now it's a true specialty, a medical specialty, and with a board certification, and to this point, you mentioned the MAHA Elevate, all those grant application. What do you think? How it happens, and especially what is the important role the ABOM play in this process?
Yeah, thank you. I feel like in the early days, the lifestyle medicine movement decided that it was going to base its foundation on science. So we chose to be a scientific movement, a movement that looked at research and looked at data and used that to create the principles and the objectives and the steps that we were going forward with. It's one of the reasons I loved CHIP so much, is CHIP was based on science and based on data. And so it was a good idea, but it also had the science underneath it. So I think that made a big difference. And in the early days of our movement back in the 2000s and even the 2010s, that was the thing that we were trying to prove, is that we were scientific, that this was not just a crazy idea. It was based on what the science said. Over the last 10 years or 12 years or so, the movement has moved past the science piece. We're in the space of, how does this work financially? We've been able to have some success in that. And one of the things that the American Board of Lifestyle Medicine, which I'm not involved in that anymore. I was the founding chair of that, but I still talk to the executive director, Stefan Herzog, on a regular basis. He's one of my friends, so I keep up with it. But one of the things that they're seeing is two things. One is, now there's this lifestyle medicine residency curriculum. So that's hundreds of residencies around the country that are teaching lifestyle medicine. And these are all different types of residencies. Some of them are primary care, family medicine, internal medicine. Some of them are like psychiatry and preventive medicine and pediatrics, all kinds of different residencies. But they're teaching residents that. And now as the residents finish their residency, they can take the American Board of Lifestyle Medicine exam without any additional work. They can just sort of document that they were part of this lifestyle medicine residency curriculum initiative. So there's people coming in with that. But the other thing that's driving people into the American Board of Lifestyle Medicine is corporations. So more and more corporations, like One Medical, who's owned by Amazon now, Sharp Healthcare, Advent Health, one of the largest healthcare organizations based out of Florida. All of these are paying, Kaiser is paying for physicians to become board certified in lifestyle medicine, because they recognize the value that those physicians bring to their organization. And some of it is the perspective of care, but some of it is literally financially. There's reason to believe that lifestyle medicine is actually saving the healthcare system money.
Definitely.
So you mentioned about the lifestyle medicine curriculum. One specialty you didn't mention is actually physical medicine and rehab, PMR. And the Mayo currently has 2 residency programs doing this lifestyle medicine residency curriculum, family medicine and PMR. Actually, it's more PMR right now. I have to mention that because I'm part of the Mayo PMR alumni, so I have to mention that. And
very good. Well, thank you for saying that. And yes, PMR, there's a lot of correlation between lifestyle medicine and physical medicine and rehabilitation. So, it's and of course, the past president of the American College of Lifestyle Medicine is a PM&R physician, Beth Frady from Harvard.
Yeah, so the PMR students and residents, they had quite a lot of community activities centered around lifestyle medicine. They even have a lifestyle medicine interest group with residents leading some medical students. And the medical students even come to our community garden to volunteer in our community garden, our monthly cooking at the Ronald McDonald House. And so we do have quite a lot of those students here.
Well,
yeah. Go ahead, May.
Should we kind of for people who tune in this and hear all this about lifestyle medicine, Dr. Dysinger, would you use your word to tell people that what is lifestyle medicine and why it's so important comparing to the traditional? Maybe some people, I mean, we are still trying to promote this concept, but people are still kind of not very familiar with the term yet.
With what is lifestyle medicine? Well,
yes.
I'm gonna give 2 answers to that. First, I'll give the stock answer, and then I'll give the Rochester, Minnesota answer. So the stock answer is lifestyle medicine is a scientific approach to looking at disease processes, specifically chronic disease processes, and applying natural remedies or natural ways to deal with them first. So, for instance, nutrition, physical activity, sleep, stress management, social connections, staying away from substances that are harmful like smoking and alcohol. Those are the kinds of things that we do in lifestyle medicine. And what we know is that about 80% of all disease in the US is what's called chronic disease, meaning it lasts for more than a few weeks. And we know that about 80% of chronic disease is directly related to those things I just mentioned, the sleep and the nutrition and the movement and those kinds of things. So if we could all practice lifestyle medicine perfectly, which nobody does, not me. I know May and Jen are pretty perfect, but they're not.
We are not
I
compliant.
wait.
Yeah, nobody's perfect, so we're not going to get rid of chronic disease. But if we could be, we could actually just eliminate 80% of chronic disease, and how beautiful would that be? And of course, it's not very expensive to eat better, to exercise more consistently, to sleep longer. There's no cost to that, but it works as far as reversing some of these chronic diseases. So that's maybe a little too long of a standard answer, but that is the standard answer. Now, I want to give the Rochester answer for lifestyle medicine.
Rochester, Minnesota.
Rochester, Minnesota, correct. Rochester, Minnesota, because Jeng and May have actually made lifestyle medicine real in their clinic and in their community. And one of the things that I've loved about visiting Rochester is how they have the whole community involved. I've been to banquets there that bring in the mayor and all the leaders from the Mayo Clinic and all the leaders from business and others. And they're all talking about lifestyle medicine and how lifestyle medicine is so great for that community. So, and that's really what lifestyle medicine is. It's a cultural change. If we really want it to be successful, that won't happen unless we culturally change how we interact with food, how we make our way through life on a day-to-day basis with less stress, those kinds of things. So I feel like you all are really living out lifestyle medicine in very concrete and real ways.
Oh,
So,
thank you.
Thank you for the kind words.
And we really, I feel like it was a very special, I think 3 years ago when you came and you were able to present at the Grand Round, Mayo Clinic Grand Round, along with
Yeah.
Brenda Davis about the lifestyle
Exactly right.
medicine and the hands-on practice. I was so excited.
Yeah. So when we talk about doing the grand rounds, and one thing, and also we keep promoting the lifestyle medicine curriculum to the residency programs, and more physicians are being board certified. But when we look at the future, do you think how difficult it is? You think that we are going to get more providers buy into it? And not just getting the certificate, it's how they can really
Right.
practice it, not
Right.
just having a
Correct.
piece of paper on the wall.
Right.
Correct. And that is the cultural change that we're after. And like I said, I believe that the lifestyle medicine movement hasn't peaked, and it'll peak when it's part of our culture. You know, when a patient is looking for a doctor and says, "I want a lifestyle medicine doctor." When a doctor is looking to start a practice and say, I only want to go to a practice where I can actively do lifestyle medicine. Those are the places we need to get to, and we're getting there. I think slowly but surely we're getting there, but we're not there yet. So, one of the things the American Board of Lifestyle Medicine has said in the past, and I think still presently, our job will be done when we're not needed anymore, when this training, this lifestyle medicine training, this ability to start with a nutrition prescription or start with a meditation prescription. If we can start with that before we give the pill, before we give the procedure, then and that's sort of standard of care as far as all medical education, all residency education. When that's the case, you won't need an American Board of Lifestyle Medicine anymore because everybody will be practicing from that lifestyle medicine mindset. Exactly. So we still have a ways to go there. I think we now have over 10,000 people who are board certified in lifestyle medicine in the US and around the world. So it's a lot of people. And that's pretty good considering the certification only started in 2017. That was the first year of certification. So we haven't even had 10 certification exams yet. So we're averaging over 1,000 people every year getting certified. But there's so many more, as you referenced, so many more to go. But you know, all I can say is the trajectory, the growth has been rapid, and it's not slowing down. If anything, it seems like it's speeding up. And so there's reason to believe that eventually we're going to get that cultural change. And with the federal government behind it, with corporations now behind it, I'm optimistic that we'll get there.
Next one is the insurance, right?
Insurance, yeah, I'm a little skeptical about the insurance industry. I think they consider lifestyle medicine an enemy, actually, rather than a benefit because it lowers overall healthcare costs. And as much as we think that insurances want to decrease healthcare costs, they actually don't. They're actually motivated to increase healthcare costs because their profit is a percentage of the overall cost. So they would rather have costs go up and up and up. They want to act like they're interested in lowering costs, but they, you know, in their boardrooms, they really want healthcare costs to go up and up. That's how they make the most money. So I'm a little skeptical of insurance companies as far as actually becoming supportive of lifestyle medicine, but who knows? Some like Kaiser, where you know, Kaiser is all in. So for them, if they lower healthcare costs, they actually make more money. But there's a few of those around. Group Health Cooperative in Washington State was one. There's another one called Harbor Health in Texas. These are companies that are both healthcare providers and insurers. And for them, lowering overall healthcare costs makes sense. But for the classic insurance companies, and I won't give their names here, but you all know the big insurance companies. For them, it actually is to their benefit to increase healthcare costs, not to decrease healthcare costs.
So when we talk about the healthcare cost and we talk about how effective lifestyle medicine is, can you give us some examples for for example, how effective it is to prescribe medication in diabetes? Right now, GLP-1 is big. And how about all the GI issue like that? So do you have any examples that they can give us?
Yeah, so I'll give two examples. First, I'll say we're still looking for more examples. So the lifestyle medicine movement needs more examples of how lifestyle medicine is actually saving money. But you know, I'll give three examples. One example is just from my clinic. So in the early days of my clinic in Southern California, we collected data around what we call the triple aim, which is patient satisfaction, clinical outcomes, and overall healthcare cost. And we obviously wanted high patient satisfaction, great clinical outcomes, and lower healthcare costs. And we found that our clinic, which is a primary care clinic practicing from a lifestyle medicine foundation, that our clinic was saving Medicare approximately 40% across a 2-year study that we did. So the patients that were fully engaged in the lifestyle medicine had a 40% lower cost. And if you think of how much Medicare spends per patient, you know, it's in the neighborhood of $15,000 per patient per year. That's 40% decrease. That's a lot of money across the millions of people on Medicare here in the US. So that's one example. The second example is an organization that you all were affiliated with for a while. Unfortunately, it doesn't really function, at least in its initial way anymore. It's called Popular Health. So Popular Popular was a network of lifestyle medicine physicians, private practice lifestyle medicine physicians. And Popular was able to show that their members on average decreased hospitalizations and ER visits over time. And then the third example I'll give is just from a webinar yesterday. And this is not a cost one, it's more of a clinical outcomes one. But we know that, for instance, diabetes, if you lower the hemoglobin A1C about 1 point, it'll save you about $1,500 across a year. That's old data from Mary Delaney. So this webinar that I was at yesterday was a Harvard webinar and was looking at lifestyle and GLPs together. So we know that lifestyle medicine makes a difference. We know that GLPs makes a difference. And the data they showed, and I'm going to not quote exactly, but pretty close. They said GLPs tend to lower overall, or tend to improve overall healthcare outcomes by about 20%. They were specifically looking at, this was a study that's been published, they were specifically looking at cardiovascular outcomes, what they call MACE, major cardiovascular events. And it was GLPs were able to lower it in the neighborhood of 20 to 22%. Lifestyle medicine was able to lower those events by 30 to 33%. But if you put them both together, you lowered it by like 43%. So there's a place for the lifestyle medicine. Lifestyle medicine is actually more powerful than the medications. There's a place for the medications for people who, for whatever reason, can't bring in lifestyle, or so there's a place for both. But if you put them together, that's where you get the biggest results. Okay. So all to say, these things do make a difference. And like I said, we do have science now, but we need more science on the cost side.
Yeah, there's certainly a place for medications. A lot of time patients look at us and they were just surprised that you do prescribe medication. We say, yeah, we do.
Yeah, and we're not embarrassed about that. No, there's a place for them. Yeah.
And I think for practicing lifestyle medicine for us is really to see the patient improved. And that's how we get enjoyment of being in the healthcare. But at the same time, doing the lifestyle medicine for general public is more of the concept of longevity and vitality. It's not just living longer, but you're really having a life as long as you are alive. And that comes to the study of blue zones. Now, there's a blue zones where people live longer and healthier, and we know that you're now involved with blue zones. Can you tell us what blue zones are?
Sure. So thank you for that. And so yes, my clinics actually merged into an organization that's now called Blue Zones Health. Blue Zones Health works with an organization called Blue Zones, which was developed by a gentleman by the name of Dan Buettner. Dan Buettner was an explorer and a journalist, and he decided that he wanted to try to find the longest living populations in the world, and then sort of back engineer to figure out how these populations became so long living. So what were they doing that could be then reflected in other populations? So he eventually identified 5 populations around the world. So the first one was in Sardinia, which is in an island in the Mediterranean, part of Italy. The second one was in Okinawa in Japan. A third one was back in the Mediterranean, an island called Ikarios, which is part of Greece in the Mediterranean. And then a fourth one was in Costa Rica in Central America. And then the fifth one was in Loma Linda, California, which happens to be where I was born and where I currently live. And so those were areas where there were more centenarians, more people who lived to 100 than average. And they seem to be living to 100, as Blue Zones has a tagline. It's live better longer. So like you said, Jing, we don't just want to live longer. We want to have high quality life. We want to have that vitality. And so Blue Zones is trying to help you live better, but also longer. And so Blue Zones said, once we now have identified these reasons, and the reasons are basically the same things that I identified as when you asked about the definition of lifestyle medicine. It's eat healthy, exercise, have great connections, those kinds of things. But they said, can we bring these into communities and help communities gain these? And so Blue Zones has been doing that for the last 20 years around a lot of communities across the U.S. And actually, the very first community was there in Minnesota because Dan Buettner is originally from Minnesota, so not too far from you. But there's I don't know how many, but it's I think in the neighborhood of hundreds of communities across the U.S. that Blue Zones has worked with now to achieve that. Blue Zones Health is saying you can change communities. We can change walkability, we can change restaurant menus, we can change a variety of different components to our community, but how about let's change healthcare as well? Let's have doctors who are certified in lifestyle medicine, and let's have approaches to healthcare where we're prescribing community gardens, like you all are able to do there, and we're prescribing what Blue Zones calls walking moais, which is moai are a group of people that do things together. So let's have a group of people that walk together on a regular basis, or let's have physicians prescribe yoga to the local yoga studio rather than prescribe the latest medication for the high blood pressure.
That's wonderful.
So it's a new concept. Blue Zones Health is still evolving in what it looks like and where it's going to end up, but we're excited about the opportunities.
So, Dr. Dysinger, you mentioned nutrition as one of the important 6 health pillars. We also know that to live a purpose fully in life, that also is very important. It's a drive. Would you please share with us, like during at your clinic when you practice, when you encountered with a patient and come in, how many of them actually understand about the lifestyle medicine and how you help patient to really accept this concept?
Yeah, thank you for that question. And what I'm going to say to start off with is in our clinic we have 4 pillars. We don't have 6 pillars. We have 4. The 4 pillars concept was originally developed by Dr. Dean Ornish, who is another mentor and one of the pioneers in the lifestyle medicine movement, along with Dr. Deal and others. But the 4 pillars, it's nutrition, so that one's no different from the American College of Lifestyle Medicine. It's movement, so that one's also no different from the American College of Lifestyle Medicine. Our 3rd pillar is what we call renew. And these 4 pillars that we're talking about in our practice, they come from the Blue Zones movements. So Blue Zones has 4, what they call their core 4, nutrition, movement, and then they have stress less. We use the word renew sometimes, but that combines sleep and stress. And why do we do that? We do that because sleep is generally a challenge if stress is a problem. So my patients who are challenged in their sleep, I work on stress with them, and when their stress is better, they generally sleep better. There's a direct connection, and that was sort of what was found in the Blue Zones as well. And then our 4th pillar is what we call connect. So the American College of Lifestyle Medicine has a social pillar. We call it connect, and we talk about horizontal connection. We talk about vertical connection. And if you look at the Blue Zones, they have under their core 4, they have what they call their power 9, and 3 of the 9 fall under this connect or social piece. They want you to connect to your family, so they say family first. They want you to connect to a group of friends, so they call it the right tribe. So these are people that help you in your health endeavors, and they also want you to connect to a spiritual community. They call it belong. So belong to a church or a synagogue or a mosque or a temple, whatever your community is, your spiritual community, but have connections in those areas. So those are our core four. And how we implement that in our practice is, first off, every visit, every patient will be asked, how are you doing in those four areas? So it's a little questionnaire that we give them. Initially, we have to explain it to them, but after they've been coming for a while, they just fill it out. We fill it out on paper, and then we enter it into our electronic medical record, and they just fill it out themselves. They know exactly how to do it. And that affects our interactions with them. It affects what we prescribe to them. And then we do start off with the lifestyle prescription first. So if someone comes in, say they sprained their ankle, there's various things you could do, but classic doctors would maybe give them some ibuprofen for their sprained ankle. Well, we give our anti-inflammatory diet. So it's foods that are very high in antioxidants, and we prescribe that to them and say, this can help you in more than just healing the inflammation in your ankle, and it's way less risky, and it's probably less cost too. And so that's the kind of thing that we do in our practice. We do that not just for little things like sprained ankles, but for bigger things like diabetes diagnoses and high cholesterol and those kind of things as well. And then in our practice, we also have a lot of health coaches, and we have a lot of group visits. So patients will come and they'll fine-tune their lifestyle choices by interacting with the health coaches and interacting in one-on-one as well as in groups with those health coaches.
Wow, this sounds very interesting. That's truly a lifestyle medicine practice. So I do have two questions about blue zones. Number one is, they're all concentrated 5 areas. Are you sure they're not genetic? And number two is, there's a rumor that there will be the 6 blue zones being announced soon. Do you know which one it is?
So good questions. So the scientists that were working with Dan Buettner, as far as identifying these blue zones, they were mainly in Europe, but they spent a lot of time trying to understand, are there genetic components to these blue zones, and there probably is at some level a genetic component to the blue zones, but they also found that obviously 5 areas of the world, so it's not the exact same genes in Okinawa and Sardinia and Costa Rica. They're different gene pools. So it's not that there's no data around genetics, but it's not the only thing. These lifestyle factors clearly are very, very important. And, one of the things that's interesting is Dan Buettner described these blue zones, 20, 30 years ago. And during that time, cultures have changed and life has happened. So specifically, some places, Okinawa, Japan is one that's mentioned a lot. It's not as rural and not as untainted by, quotes, Western civilization and the SAD diet, the typical, the standard American diet, the SAD diet. So those things are coming into these blue zones communities and challenging the blue zones concept there. The other thing I'll say is that I lost my train of thought there. Your question was, is there a new blue zone coming? So the thing I'll say on that is, a few years ago, Dan Buettner spent some time in Singapore, and Singapore is a very modern society that goes out of their way to try to promote health. So as an example, I have a friend of mine that I was talking to last week who just spent a week in Singapore, and she said, I was walking along the streets, and here was this small park, and here was a sign that said, "Don't just enjoy this small park. Look at the leaves of the trees. Look up at the blue sky." Just sort of trying to bring in that meditative atmosphere. So the park doesn't just sit there. There's actually guidelines of how you stress less in these parks. So when Dan Buettner was visiting Singapore, he said, this is a modern blue zones, and so this is the sixth blue zones. So that's sort of been said, and I don't know if that's what you're referencing, Jeng. I don't know if there's some other thing coming up that I don't know about, but that's what I've heard about as six blue zones. Now, if you look at all the blue zones literature, it still tends to focus on the original five, but clearly some of the original five are losing their luster a little bit, and some of these new ones are coming along where again the culture is, the old culture was really good. New culture has sometimes been worse, but some countries like Singapore are trying to bring in new culture that's actually really healthy.
I think I saw the news maybe last month or 2 months ago saying the sixth one will be announced soon. So I don't know.
Yeah, the only sixth one I've heard about is Singapore.
Well,
But
great.
who knows? Maybe there's going to be another announcement. Who knows?
Another thing I really want to bring up is I think May and I were very impressed when we listened to the podcast with Chef AJ. And Chef AJ mentioned a lot of wisdom from her conversation with you. Especially you mentioned something about rigidity impaired healing, all those. Can you elaborate more about those conversations?
Yeah, so people who maybe aren't familiar with Chef AJ is a chef who's a plant-based chef, and she has been one of the leaders in what I call the SOFA's free movement. SOFA's free is SOFA is an acronym, and the S stands for sugar, the O stands for oil, the F stands for flour, the A stands for alcohol, and then the final S stands for salt. So Chef AJ, developed recipes and menus and food approaches that had no sugar, no oil, no flour, no alcohol, and no salt. So that's a very aggressive approach. But over the last few years, for a variety of reasons, many of them quite personal, Chef AJ has decided that there was a rigidity to her to a sophist free approach. So it's almost a legalistic approach, and I felt for a long time. I'll never forget this friend I had who was a vegan, so didn't eat any dairy, no meat, nothing. But this friend was exposed to pizza, and she loved pizza actually, and she decided to have a piece of pizza. And then she was coming to me and saying, "I feel so guilty. I just am ashamed that I ate this piece of pizza. I can't believe that I let my guard down." And I said, your guilt and your shame is worse on your body than the cheese that was in that pizza. So I felt for a long time that rigidity and legalism kind of approaches, legalistic approaches, almost cult-like approaches to food, actually weren't very helpful. We have some general principles, eat food, not too much, mostly plants. These are our general principles, and we want to follow those general principles. But we also need to be flexible. We need to sort of go with the flow a little bit. And so that's what I was talking about with Chef AJ. And it sort of brings, back to the four pillars. Food is just one of those. Stress management is also a very, very important one of those. And we can work so hard on something that it actually increases the stress in our life and makes overall health more challenging rather than less challenging.
Right. And I think on that comment, I mean, especially when people went through CHIP program, and sometimes when we ran into the grocery shopping at a grocery store, or some occasion, and they will feel guilty. I'm so sorry that I cheat. And I say, don't use the cheat, because if you want to enjoy something, have fun, to have piece of a cake, have a sugar, enjoy it. And then that is only, once a while. So you don't need to be perfect. Yeah.
Yeah, if you had a body camera and watched me as I go through my life, unfortunately, you would see me cheating. Probably more than I'd like to admit, but it's, we're all humans and we
Yeah.
all have certain cravings every once in a while, and
Yeah.
we don't have to be perfect, but we do, as you said, May, we do need to have a trend in the right direction. We need to be going in the right direction. We need to sort of do things that will allow our cheating to be minimal, whether it's serving size or frequency or whatever. We can have a great life, thoroughly enjoy our life, eating super healthy, but we don't have to be perfect at it. We don't have to
That's
be
right.
bring in the
That's right.
rigidity.
That's
Yeah,
right.
to really the lifestyle medicine is the life that we're focusing on, not the medicine. Yeah. So, may have any questions?
No, I really enjoyed the conversation. I know you're watching the time.
So, Dr. Dysinger, any last minute wisdom you can share with us?
I just, first off, thank you for inviting me. I appreciate
Thank you.
being here, and happy to do it again some point down the road. Thank you for the work and effort you're going into to produce this podcast and distribute it and make it available to people. And again, thank you for what you do there in Rochester, Minnesota, where you're actually changing the culture of your community and working with others to change the culture of your community. So it's patient by patient that we practice lifestyle medicine, but it's also community by community. And I'm just grateful to be part of that journey and sharing it with you and with anyone who's listening here.
Thank you. You have been very, very helpful in helping us doing the job in the community and helping us with our providers, as I mentioned.
Yeah. Very practical way. Very important. It's a personal and professional matter. Yeah.
So
Thank you.
if anyone want to learn more about Blue Zone Health or get in contact with you for some wisdom, how can they best contact you?
So email works, and my email is my first name, Wayne, W-A-Y-N-E, dot last name, Dysinger, D-Y-S-I-N-G-E-R. So wayne.dysinger@bluezoneshealth.com.
Great.
Well, Dr. Dysinger, has been a pleasure to have this conversation with you, and we have such a fun time. So definitely, we hope to have a conversation again with you in the future. So, Dr. J, that's a
I'm sure we
close.
will. Thank you.
So
Yeah. Thanks
all
for
right.
joining us on Healing Step to Wellness. I'm Dr. J,
I'm May,
guiding you toward whole person health, one step.
and one bite at a time.
See you next
Thank
time.
you. Yeah.
Thank you.
Bye-bye.
Thank you.
Healing steps to wellness. One step, one bite each day. Healing steps to wellness, guiding you along the way. Body, mind, and spirit, stronger every day.